Chapter 16, Digeneans. Part 6, Pathogenesis. When we look at the pathogenesis, we're going to see the majority of the pathogenesis is due to the eggs. The eggs passing through your tissues. The eggs ending up in the wrong places of the bodies, and those granulomas continuously grow until on x-rays and MRIs, they can appear as though they're large tumors. Large being relative. Remember, a large tumor can, be something about the size of my thumbnail. They will show up on x-rays. That fibrous tissues that will form, that quote-unquote scarring, internal scarring, that is the pathology you're going to see with schistosomas. This primary lesion that you will see as these eggs are passing through is going to be due to delayed hypersensitivity. The cells are going to slowly become activated as more and more start to group around. You see here in the center, right there. I meant to highlight, not draw a stupid circle. That's the egg. The egg, which is surrounded by, you see out here, you see all of these different cells. These cells that are slowly accumulating, layer upon layer upon layer. As they accumulate, they become denser. They help move the egg until it can't be moved. Either it passes into the lumen or it reaches a region where it just can't go any further. We see 3 phases with the pathogenesis, with this disease. First is going to be what they call the migratory phase. This is when, from initial penetration until maturation, okay, the cercaria getting in, going through the bloodstream, male meets female, they go to one of the veins, large intestine, small intestine, bladder, and that's where they stay. Eggs start to be produced. Pretty much it's going to be symptomless, okay? You're not going to have a large number of flukes moving around. You're not going to have a lot of stuff going on. This is happening within a few days, so, cellular immune response, the innate may be kicking in, but the adaptive hasn't had a chance yet. For most people, the worst part's just going to be some mild dermatitis at the site of penetration, okay? It's going to look like a little rash or something going on there. Swimmer's itch, a lot of people will refer to it as. Then you get what's also the acute phase, commonly referred to as Katayama fever. Okay, this is 1 to 2.5 months, 3 months after the infection has begun. Then you start to see the innate kicks in. The innate immune response, the humoral immune response kicks in, B cells, T cells. You're going to get lots and lots of antibodies being produced. Too many antibodies being produced because of this. That's what this complex is talking about. Since you're having overproduction of antibodies that should be binding to schistosoma, but they can't. They're floating around the blood and they start binding to each other, making these complexes that literally just come out of solution. And they start depositing in weird places, different capillary beds in different tissues. I read someplace they seem to also start to collect in the joints. Because they start to collect in the joints, it starts to, kick off an inflammatory response of the joints. So people with schistosoma may start to show symptoms of onset of things like rheumatoid arthritis, even though they don't have it. It's the actual over response, the incorrect response of the B cells overproducing antibodies, and the antibodies have nowhere to go, so they just start coming out as complexes in the joints. You also see things that are referred to as pseudotubercles. Okay, these are the granulomas, or the egg, and you start getting more and more and more layers and layers. Well, the inner layers start to die. The outer layers keep packing on. Inner layers die, liquefy. You'll also start to see the older granulomas. The longer they're there, they may actually even start to accumulate calcium, which is why they, start to, the older granulomas will start to show up as spots on X-rays. Remember, anything calcified, bones, shows up. Generally, most soft tissues, you might get a ghost of an image. Well, these things light up, spot, 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 because the older ones start to calcify. That's the pseudo tubercles, especially when they show up in the lungs. The chronic phase, this is long term. This is a year plus after infection. Most people, asymptomatic or mild symptoms. If it's mild, they might have bloody diarrhea, bloody urine once in a while. Okay? Bloody diarrhea because enough of the eggs are coming out in certain areas in a certain region that it's starting to perforate the intestines a little. Get some blood in there. The bloody urine, because you get enough of these eggs coming out into the bladder, you're literally bleeding into your bladder. It's passing out in the bloodstream. Get enough of them passing out over a long enough time, you start to get that fibrous tissue. Remember, like I said, think of it as an internal scarring. A lot of people also start to accumulate fluid in their coelom, in the abdominal cavity, because of this overall body inflammatory response. Think about it. Last time you had a wound on your hand, your foot, wherever, you notice it started to swell up, got warm. That's the inflammatory response. The capillary beds get leaky, so fluid, plasma, all the plasma proteins, the antibodies, the complement can flood the area. It also brings in, the innate as well as the adaptive immune cells. Well, this fluid accumulation in the abdomen, in my mind, that's because head to toe, overall body inflammatory response, low grade, means there are going to be fluids coming out of the blood, and it's accumulating, and it's giving them this distended belly look, as you see right here. Also, because of what's going on, there's going to be some abnormal development, nutrient uptake, nutrient usage. A lot of the nutrients that they should be using for normal cellular metabolism, tissue growth, overall body growth is being shunted over because of this head to toe inflammatory response. So you see the individual on the right in this picture, you read the caption below it, they're 24. They're almost twice the age of the 13-year-old kid on the left. But body size-wise, they're the same. You look at the face, I don't know if it's just because of the way he's holding his face and the shadowing, but he does look older. But the body size is still the same. And you go through and you can actually see, where is the eggs? The eggs, eggs are E. Where is E? There's E. There's an egg. There's an egg. There's an egg. They're surrounded by different tissues as they are moving through, or surrounding by different cells as they are moving through the tissues. They're being propelled. The eggs aren't swimming. They're not moving. Remember, there's no musculature, nothing like that. They are just, they got about as much movement capability as my phone does. but they're being propelled through the tissues by the tissues themselves, by the immune cells that are forming the granuloma.